And welcome everyone to this webinar. We're going to talk about diabetes, and that's a thing that I've been working with for many years as a member of the European Parliament, and I am a co-chair of the members mobilizing for diabetes in the European Parliament together with Sirpa Pietikäinen. And luckily, the Commission, EU Commission, has also come up with a new initiative. In the beginning of this mandate, they focused very much on cancer, and now they made a new initiative concerning non-communicable diseases like diabetes. It's called Healthier Together. And for me, I do believe still that it is possible to make a better everyday life for citizens, for patients with diabetes. And I do believe that it is impossible also to prevent more cases. So we need to learn from each other, and we need to have a higher political focus. And if we do that, then we can hopefully by the end of the day make it together and make us all healthier together.
Together with my family and my friends, insulin is my most important lifeline. And currently I am 25 years young, diagnosed at the age of 15 with diabetes, and I have been living with the condition for already 10 years, and I will be living with it for the rest of my life. Diabetes requires round-the-clock management 7 days a week in order to survive.
When we talk about diabetes, we actually talk about a very mixed bag of diseases that all have in common that they make blood sugar rise. As research progresses, as evidence progresses, we are identifying more and more causes of this very heterogeneous bag that is diabetes mellitus. IDF publishes every year the data on diabetes worldwide, and we'll be coming back to this later on. There is an increase in the numbers of people living with diabetes, especially in the emerging economies.
Europe has the world's second highest health expenditure per patient with diabetes. And patients with diabetes account for third largest number of potentially avoidable hospital bed days spent in Europe amongst chronic diseases. It's a big number.
In the World Health Assembly, the member states passed a resolution on diabetes, urging member states, where appropriate, to intensify their efforts to address the prevention and control of diabetes. Within the proposed targets, a set of targets have been developed. This was developed by WHO with an academic group during last year, put out for consultation and then further refined. And these targets are not individual treatment guideline targets, but rather global coverage targets to capture areas of missed opportunity, particularly around diagnosis and treatment gaps. And they're intended to be ambitious, but also achievable and measurable at country level. And these would then be monitored on a voluntary basis with member states.
There are quite a number of policies within the EU that can support action. But probably the most important initiative of all is the newly launched NCD's initiative, Healthier Together. And that initiative marks a big shift in the Commission's thinking on NCDs.
It is very clear that this has a very strong physical, psychological, economic burden, as it was said, to individuals, but it burdens our societies. And the good news started to come after that. It is the costs on the wrong place. And if we can move up this amount of money that we are using in the later stages of diabetes to upfront on right actions to understand the diabetes, we would be very far from here. So the diabetes deserves upgraded EU-owned program.
Mostly, I think that we can do more, so we should do more. And as we heard, there's so many things on the table in the EU at the moment: the pharmaceutical industry, the AI legislation, the health data proposal, etc. And many of these things would help people with diabetes have a better everyday life. So we should do it. We should take everywhere we can do something, we should do something. But most of all, I think I'm optimistic because it matters, and we must and we can do more. And that's what I take with me. And together with Sirpa, we will speed up and try to put diabetes higher up on the agenda here in the European Parliament.